Hello, my name is Robert Brill. I'm a fibromyalgia advocate and PhD candidate in health psychology, and this is my fibromyalgia podcast series. Today I'd like to discuss neurotransmitters and fibromyalgia. There are dozens of neurotransmitters in the brain, but for the purpose of understanding chronic pain, I intend to only focus on the most significant neurotransmitters: acetylcholine, dopamine, GABA, glutamate, melatonin, norepinephrine, serotonin, and substance P. Biopsychology is one of a number of branches of psychology that deals with low neurotransmitter influence on behaviors, thoughts, and feelings, also known as neuropsychology. Nerves are the starting point of pain. Nerves are where you first receive impulses and where you start to process and transmit neurotransmitters. At the end of the nerves are your nociceptors. These are receptors that detect pain, or actual or potential tissue damage, and these are suspected to be impacted by fibromyalgia. Nociceptors are everywhere, which explains why you can have pain everywhere with an illness like fibro. Nociceptors detect pain and transmit a signal to the brain, passing through the dorsal horn in your spine on its way to your brain, where it triggers the release of neurotransmitters, which activate other nerves that send messages to the thalamus for processing and sending out multiple pain messages. So obviously this is really complicated, but I'm trying to simplify it for you. Multiple pain messages help to explain how we experience several different types of pain and several levels of severity of pain. Everyone reacts differently, and how we react to pain is stored in our brain for future use, or for reference for future pain. In most cases, the older you get, the more pain you have experienced in life, and then this actually prepares you for future pain, helping you build up a tolerance to pain along the way. So thus, pain becomes a normal part of life. What was just explained describes acute pain that is said to serve a purpose. Chronic pain, on the other hand, has no purpose. With chronic pain, like fibromyalgia, the nerves being triggered become accustomed to being in pain, causing physiological changes to the affected nerves and surrounding areas, and they become chronic. In most areas, chronic pain is difficult or impossible to diagnose or pinpoint. And with many chronic illnesses like fibro, this is what happens, and the nervous system becomes the source of the pain, making the pain next to impossible to manage. The primary role of these neurotransmitters is to activate receptors, and through an excitatory or inhibitory response, to affect our mood, appetite, anxiety, sleep, aggression, temperature, heart rate, fear, and many other physiological and psychological events. Excitatory neurotransmitters stimulate receptors, and while inhibitory neurotransmitters block receptors. Many actions can trigger the release of neurotransmitters. It is suggested that chronic stress, poor nutrition, and a fast-paced lives can help lead to the depletion of these neurotransmitter levels. There are three primary types of neurotransmitters: amino acids, peptides, and monoamines. Amino acids include glycine, glutamate, aspartame, and GABA. Monoamines include acetylcholine, dopamine, norepinephrine, epinephrine, histamine, and serotonin. And peptides include substance P, endorphins, oxytocin, insulin, glucagon, vasopressin, and many more. Neurotransmitters are made primarily from amino acids, which mostly come from your diet. It's suspected that neurons communicate via these chemical releases. Most effective psychoactive drugs, like antidepressants and narcotics, they actually affect the neurotransmitters at one level or another, altering brain chemistry, and in some cases working on our anxiety or reducing our pain level. All neurotransmitters are interconnected through a delicate system of balance. General anxiety disorder, for example, is suggested to be the result of a malfunction of several neurotransmitters in the brain, making general anxiety disorder difficult to treat effectively. Neurotransmitters carry impulses between nerve cells, primarily dopamine, serotonin, and norepinephrine. Some foods are known to influence brain behavior, and thus neurotransmitters that regulate behavior. Serotonin is suggested to be released from the carbohydrate foods, thus making junk foods our comfort food. You eat these foods, serotonin is released, and tension is reduced. Alternatively, if norepinephrine or dopamine were released from proteins, you would feel excited or alert versus relaxed, as with serotonin. Complex carbs and fatty acids like salmon and whitefish would then stimulate the release of norepinephrine and dopamine. Foods high in saturated fats like burgers and fries would lead to slow thinking and fatigue. Eating more carbs than protein relaxes you, while eating more protein than carbs alerts you. So fat inhibits the production of neurotransmitters. Eating simple carb foods provides a quick burst of energy and then produces fatigue and sometimes even depression shortly after. In depression, heredity can be a factor, but so can the lack of exercise, poor nutrition, and the ability to relax oneself, which can actually affect us at the chemical level. So you can quickly see how the wrong diet can exacerbate your fibro. Beyond these attributes, our body chemistry can also be affected by our thoughts, emotions, and behaviors. Low levels of norepinephrine are observed in depressed people, for which relaxation can stimulate an increase in norepinephrine. Depression, anxiety, sleep issues, and sexual activity can be positively influenced by the release of endorphins, of which exercise can stimulate. So clearly all these neurotransmitters can be affected by many different things, positively and negatively. When all these things can be managed by you, known as serotonin management, you can turn to medications like antidepressants to help you. Permitting yourself the positive influences and eliminating the negative ones, in this case catastrophic thinking, in your lifetime can essentially promote wellness. If you're able to do a number of positive behaviors like exercise, good nutrition, proper needed meditation, stress control, guided imagery, talk therapy, just to name a few, these influence the production of serotonin, and you may be able to manage your depression to some degree. And for most people, depression is a major factor in fibro. Dramatic events in your life like a death, serious injury, chronic illness, a pregnancy, a birth, they have the ability to cause an increase in depression, most often only temporarily. Studies have conducted that over periods of time, neurotransmitter levels will actually return to normal. This period of time can be for a few months or up to a few years, depending on the event, the person's biology, their coping skills, support structure, and their future ability to move on. Chronic worrying can have a negative effect on neurotransmitters as well. Conceptual worrying is normal. It's the constructive type of worrying. It's involved in reaching our goals, for example, whereas reactive worrying has destructive results. When disease or illness is present, there's a disruption in the flow of neurotransmitters. Reuptake describes the process that the neurotransmitters go through where they're picked up by the axon terminal that originally released it. This is a normal process, and it's a common way that norepinephrine, dopamine, and serotonin are interrupted and stopped. Reuptake removes the neurotransmitter from the synaptic cleft, and then they'll be left there to bind to their respective receptor, and then they can perform their job. Acetylcholine is both an excitatory and inhibitory neurotransmitter, and known to play a role in Alzheimer's disease. It's found in the central and peripheral nervous systems, and it's involved in muscle stimulation and REM sleep. Botox inhibits acetylcholine from aiding in muscle stimulation, causing a form of temporary paralysis. Dopamine is the inhibitory neurotransmitter made in the brain and is similar to adrenaline and has the role of the reward system, social anxiety. It affects motor system, cognition, and our endocrine system. It controls movement, emotional response, pleasure, pain, plays a role in addiction, and it causes excitability. It also plays a role in mental and physical health. When dopamine transmitters, when the neurons from these die, the result is Parkinson's disease, which is really little or to no dopamine. So dopamine agonists can also treat restless leg syndrome, which is believed to is caused by a shortage of dopamine in the brain, and also depression, schizophrenia, and other similar mental disorders. Drugs of abuse stimulate the dopamine receptor, which can lead to addiction. Sensitization can occur when one takes dopamine antagonists for a really long time, increasing the number of dopamine receptors. The receptors become more sensitive to dopamine, resulting in sensitization, and the opposite occurs when dopamine agonists constantly stimulate dopamine receptors, decreasing the number of these receptors. And the remaining receptors become less sensitive to dopamine. So this is desensitization, or tolerance, resulting in the need for more of this exposure. Long-term over and under stimulation of the dopamine receptors results in sensitization or desensitization. However, both can occur immediately with the use of an illicit drug. The body tries to maintain constant homeostasis even when foreign substances are introduced. Drugs like cocaine, heroin, alcohol, nicotine, amphetamines, and such, these increase dopamine levels, which are the feel-good response. Endorphins, on the other hand, are also known as endogenous morphine. They're an inhibitory neurotransmitter involved in pain reduction, stress, fear, rage, anxiety, and pleasure. It's structurally similar to common opioids like morphine, but it's not really addictive since our body makes it. Opioids attach to the endorphin receptors, and they are produced by the pituitary gland and the hypothalamus during certain events like exercise, pain, excitement, eating spicy foods, and even sex. So eating a hot chili pepper can release endorphins. Maintaining positive thought releases endorphins, similar to the placebo effect. Being inspired can release endorphins through the pleasure center. Acupuncture can release endorphins. Eating chocolate, being scared, laughing, and getting some sun can all release endorphins. Lacking endorphins can cause mental disorders like OCD and depression. For some people, self-mutilation can release endorphins, like when teenagers cut themselves, for example. If endorphins flood the hypothalamus or go on high alert, you can experience the fight or flight response, which is not healthy all the time. And this is what's suspected to be seen in fibromyalgia. We're constantly facing the fight or flight response. GABA, or gamma-aminobutyric acid, is an inhibitory neurotransmitter. Tranquilizers act to enhance GABA's effects. Low levels of GABA can lead to anxiety disorders. GABA can stop the excitatory neurotransmitter that may cause anxiety. Alcohol and barbiturates stimulate GABA receptors. Very low levels of GABA can lead to epilepsy. Anti-anxiety meds like benzodiazepines affect the GABA receptors. GABA and glutamate balance each other. Now, glutamate is the major excitatory neurotransmitter in the brain. It's prevalent in the central nervous system, and it's the most abundant neurotransmitter in the brain, and it's involved in learning and memory primarily. Low levels of glutamate can result in sleepiness or reduced brain activity. Too much glutamate can result in neurodegenerative diseases like Alzheimer's, Parkinson's, Huntington, Tourette's, and ALS, as well as leading to depression, OCD, and autism. So GABA and glutamate, once again, they balance each other. Now, melatonin is a neurotransmitter and hormone produced by the pineal gland in the brain, and it's secreted at nighttime. Melatonin sends a signal to the body that it's time to sleep. The older we get, the less melatonin is produced, especially over the age of 40. Taking melatonin at bedtime can promote normal sleep patterns. It essentially helps to regulate the sleep cycle in our internal clock, naturally, among other things. When you have fibro, you're likely not getting enough sleep, as well as having a disruptive sleep schedule, sleeping day and night. When this happens, you throw off your biological sleep clock, and you experience a number of fibro-type symptoms. Taking melatonin before bed can help to reset your clock. Since your immune system can be impacted with fibro, taking melatonin can help to restore some immune function as well. Norepinephrine and noradrenaline is the neurotransmitter and hormone that helps to regulate mood, sleep, dreams, arousal, and the reward system. Like dopamine, it's a stimulant, it fosters alertness, and aids in long-term memory and learning. In response to stress, as it acts as a hormone and working with adrenaline, it can increase blood pressure, constrict blood vessels, and increase heart rate, which again is the fight or flight response. As neurotransmitter, it transmits nerve impulses like other neurotransmitters. Antidepressants can inhibit the reuptake of norepinephrine as well as serotonin. Too much norepinephrine can stimulate fear and anxiety, and stress can deplete adrenaline, and exercising can increase adrenaline. Serotonin is an inhibitory neurotransmitter that's involved in the transmission of nerve impulses. It's produced by the central nervous system and in the intestines. It helps regulate appetite, mood, emotions, memory, temperature, depression, muscle contraction, and sleep, and it decreases nociception or pain. It's manufactured in the brain using tryptophan. Tryptophan increases the amount of serotonin made by the brain. It's present in the central nervous system, hypothalamus, and basal ganglia. Low serotonin leads to depression, anxiety, apathy, fear, insomnia, and fatigue, and addiction. Serotonin is suggested to be released from carbohydrate foods, thus making junk food comfort foods. You eat these foods, serotonin is released, and then your tension is reduced. Serotonin begins being released under many circumstances, for example, making yourself comfortable with a warm shower. When the levels are too low of serotonin, it can lead to depression, sleep issues, migraine, inflammatory bowel, anger, OCD, carb cravings, or suicide, and many of the present symptoms in fibro. Antidepressants like Prozac act to prevent the reuptake of serotonin, leaving more of the neurotransmitter directly in the synapse, and this allows the medication to help normalize the levels of serotonin. Prozac inhibits the reuptake of serotonin, leaving more serotonin in that synaptic gap, allowing serotonin to perform its function, treating depression and pain. Substance P is responsible for pain transmissions in the periphery and central nervous system. It plays a major role in chronic pain conditions, asthma, psoriasis, inflammatory bowel disease, migraine, schizophrenia, depression, and anxiety. Injured peripheral nerves cause the release of substance P into the spinal cord, transmitting pain messages. It's suggested that with fibromyalgia, substance P may be sent to the brain much more often than it's supposed to be, resulting in more pain with no etiology. Substance P is seen 3 times greater in fibro sufferers, suggesting a higher degree of pain sensation. To date, nothing is really approved to control the level of substance P. Antidepressants do so much more than treat depression. The stigma that physicians have traditionally explained to fibro sufferers that their symptoms are all in their head or psychosomatic begins to make a little sense when you really consider the relationship between chronic fibro-type pain and the role these neurotransmitters play. The relationship is strong and the overlap is significant. The next time your physician suggests antidepressants to treat your illness that is not a depression-type illness, consider that antidepressants help to alleviate pain among many other symptoms. Thank you.